How many have you done in your career?
40 or 50.
Everybody, it's Dr. Nick here. We're here with Dr. Dave. He's going to be receiving some shockwave therapy on his knee. Dr. Dave is a very avid swimmer and triathlete. When's the next event?
In spring.
Springtime.
Yeah.
So currently right now he's getting a lot of discomfort around his left knee, especially with going up or downstairs.
A little bit of both.
A little bit of both.
Probably a little more.
Up's worse. So we're gonna treat him with some shockwave, see how he feels afterwards, and give him moving just a little bit easier. How many have you done in your career?
40 or 50.
You're kidding. When'd you start?
Freshman year of college, 65 years ago.
65. Okay. What sparked that interest?
I had a buddy who did a lot of them. It kind of got me into them. Fun training with him, and then I found a group at college that we trained together with. So we got to travel and train. It was fun.
Do you see any of them still doing it? Not so much. They kind of fell off and you stuck with it?
Well, I just got back into it, but yeah.
You've never had shockwave before.
True.
Let's not do it with comfort mode because that takes too long. Have you ever been snapped with a rubber band?
Oh, sure.
Ideally, it shouldn't feel like that. Occasionally it will, but for the most part, it should feel like a pretty strong budding sensation. I'll give you a little sample here. All right. Cool with that?
Yeah.
All right, I'm gonna slowly turn up the intensity of it. The intensity of it should float between 4 and 6 out of 10.
Okay.
So you let me know when it gets there. Where do you say you're sitting at right now?
3 or 4.
3 or 4. Okay. 5. Any spot in particular more sore when I go over it?
Kind of the lower central.
More through here?
Yeah.
Is that really where you feel the pain when you take stairs?
Yeah.
Okay. So if I hang out here, what would you give it?
6, 7.
Cool. I'm gonna hang out there then. So what Shockwave is aiming to do is we're kind of disrupting some of the tissue in this area that might have healed poorly, and giving it a chance to be better the second time around. And that alleviates a lot of pain. How long has this been going on?
A couple of years, to be honest. Real low level, but just noticeable.
Do you have any history of significant injury to this area? Nothing. That's a good thing. You okay with that still?
Yeah.
Is it still about a 6 or 7 out of 10, or did it back off a little bit?
I'd say more like 5, 6.
5, 6. So that's pretty common. Once we focus on an area for a little bit, then we start to move the head around a little bit and go back to the area. A lot of times patients will say it feels a little bit more tolerable. That's what we're looking for. And you're done.
There we go.
What'd you think?
That's interesting. Yeah.
The best therapy you've ever had?
Yeah, obviously.
Awesome. Guys, thanks for watching. If you have any questions about Shockwave, feel free to leave them down below. We look forward to hearing from you.